pandemic. Okay, so let's start with a question that we just got answered from the state of Oregon. Is Oregon planning to implement contact tracing? So that's a way of tracking down who might have been infected by COVID-19 so they can then quarantine themselves. So the answer, Oregon is looking to recruit about 600 people for paid and volunteer positions to do this work, and will soon publish a website with information on how people can get involved. OHSU is looking to involve medical students in contact tracing work. You know, and now we have some questions about money and jobs. First, the federal stimulus checks. Why are some people not getting them even though they're American citizens? Kyla Boshi has the answer.
Some Americans are being denied a stimulus check because they're married to non-citizens. There's actually a little-known provision in the coronavirus relief package which denies payment to any U.S. citizen who's married to an undocumented immigrant. A Vancouver case is a prime example. A woman there, an American citizen, will not get a stimulus check because of her husband's immigration status. So you can imagine this is all very controversial. There have been 2 federal lawsuits filed seeking an injunction blocking restrictions on stimulus payments. It affects a lot of people. 1.2 million Americans are married to undocumented immigrants.
30 million people across the country have now filed for unemployment. That's about 18% of the workforce. So if you're out of work right now, what is the best way to try to find a job? Galen Etlin shares some answers from today's KGW Q&A webcast.
We spoke with a career counselor and with a PSU instructor about taking on the tough job market, and here's some of their advice. First, broaden your horizons. If a dream job isn't working out right now, try to pivot to something else, even if it's just temporary to support yourself and your family. Then research the job, the manager, the skills needed, and create a stronger cover letter and resume that show what you can do and what you can bring to the company. Now, if you do get a response, get ready for a virtual interview and practice ahead of time to make sure your technology works. And prepare answers to questions like, what's your biggest weakness?
Tell a story of how you dealt with something, but how you learned something coming out of it.
So not just how you failed, but how you grew and how it helps you to this day. Also, how to problem solve and de-escalate conflict.
Find an example of the time you used that kind of respectful communication to improve a relationship.
These are valuable skills your resume may not illustrate on its own, so be sure to share them, be enthusiastic, and show you're willing to learn even if you don't have the experience. Last, send a handwritten thank you note to the employer about what this opportunity means to you. You will stand out for all the right reasons.
Great tips. Now let's talk about how the pandemic is changing the world and how things will look different when things reopen. I want to bring in futurist Steve Brown. He's our live guest tonight. And Steve, let's start off with an easy question for you. Talk about your job. What does a futurist do? What do you specialize in?
Yeah, I'm lucky. I get paid to spend most of my time thinking about the future, and not just about what's going to happen next year, but what will the world be like 5, 10 or more years from now? And to do that, futurists like me track important trends and work out what will be possible and roughly when. And so it's not about making predictions, but thinking about possibilities and thinking about technology trends like artificial intelligence or augmented reality, robotics, business trends like the sharing economy that brought us Uber, Lyft, and Airbnb, and most importantly, people trends. What do people want? What are their relationships like? What are their behaviors? What are their aspirations in life? And so on. So by combining those trends together and using their experience and quite honestly their imagination, we work to figure out what will become possible. And so I advise businesses all around the world on what's next and hopefully inspire them to build a better future for people in the process.
Such an interesting job. I know we've had you on KGW Sunrise, and it's always so interesting to talk to you. So we are all so curious to know what the world will look like when things reopen again. I mean, how do you predict, how do you see businesses changing?
Well, I think largely they're going to be the same, but different. And all businesses need to recognize that there is going to be a new normal. We are not going back to the way things were in December 2019 magically. That's just not going to happen. We're going to see more efforts to automate and to digitize the way that businesses operate, to make it easier for people to interact with them digitally, to do so online. And you've seen a lot of businesses already make those kind of changes. And there'll be new ways that they deliver products and services. And if you think about it, we see restaurants in town here already delivering meal kits instead of serving meals in their restaurants. Theaters starting to do shows online. Grocery stores are going to start to accelerate their investments in using robots to deliver food to your front door. Because this is going to go on for a while. And I hate having to say this, but social distancing is going to be in place for some time. It's going to be in place until we can get, majority of people vaccinated. I did a little bit of math earlier when I was preparing to talk to you today. There are 328 million Americans. I'm one of them. Social distancing is going to continue until we can get people vaccinated. If we can vaccinate one American every second, and we do that 24 hours a day, 7 days a week, it would take us 10 years to vaccinate everyone. So we're going to have use our ingenuity to really work hard to vaccinate people as quickly as possible so we can really start to return to normal. But that's a while off.
Yeah. Let's talk about the workplace. I mean, how do you see the workplace change when people return to their offices?
Yeah, I mean, we're going to be continuing social distancing for a while. So social distancing practices are going to have to be continued at work, increased cleaning practices, those sorts of things. I think we're going to see more remote, also known as distributed work, people working away from their offices for quite some time. Now, there's some circumstances where you can't do that. If you're a meat packing plant, you can't have people work from home. But in circumstances where you can, I think you're going to see a lot more of that, which is going to mean embracing and developing much better collaboration tools and creating an experience for employees that's digital, so they can just pick up and move and work from anywhere, wherever that's possible. And there are going to be benefits to companies that make that change that last way after the pandemic is past us. It makes them more flexible, reduces commute time for their workers. None of us enjoy that particularly. I used to do the run on 26 every day for many, many years. But it also makes businesses more efficient, reduces their real estate costs, and gives them better access to talent. The best person for a job may not live in Beaverton. They may not even be in Bend. They might be in Boston or Berlin. And enabling people to work remotely means you get access to the very best talent on the planet.
And schools, how do you see schools operating after, the pandemic? Do you see distance learning really being the norm, through next year?
It's certainly going to be a very important component of education. I mean, there's real value in getting kids together in classrooms so they can interact with each other when it's safe to do so. And over time, I think we'll see that happen. But what we've learned through this process is that online learning has real benefits, particularly in higher education. It breaks the boundaries of time and space. Suddenly, you get access to the very best teaching talent on the planet, wherever they may be. And so it may be a different experience. It'll take us a little bit to get used to it. But this may be the future of education, at least as a component going forward, that it will have this mix of physical in-person education and the digital education that goes with it.
And then I also wanted to ask about healthcare. What long-lasting changes will we see in that industry?
Well, if we're talking about healthcare, I mean, just let's pause for a moment and thank you to the healthcare workers who are risking their lives to help others. Thank you for everything that you do. I think as a futurist, I've already started to get into the headspace of how do we build a pandemic-ready society? And to do that, part of that effort is we need to build a pandemic-ready healthcare system. And to do that, I think we can use a lot of technology, for example, delivering telehealth as the norm, so that the standard way you see a doctor, they don't really need to examine you close up, is to talk to them online. Doing digital and automated contact tracing, but doing it in a way that respects individual privacy, elevating the capabilities of healthcare workers, freeing them from paperwork by using artificial intelligence and other technology to do all that for them, and reducing their burnout. It's incredibly stressful working in healthcare, even before pandemic. So there are ways we can use sensors, new networks, artificial intelligence, and other technology to help look after people with chronic diseases while they're at home. Better for the patient, and better to reduce the burden on the healthcare system so it can scale more when pandemic comes along.
All right, Steve, thank you so much again for your time and just for your insights on, what the world will look like moving forward. Thanks again.
My pleasure. Thanks, Kristen.
At any time, you can send in your questions. There's a new number to text. It's 503-226-5088. Now, if we don't get to your question tonight, we'll be answering your questions right here at 7 o'clock, Monday through Thursday. Still ahead, how long will it take for us to get a coronavirus vaccine? When can this process be sped up? And welcome back. A lot of people have questions about health insurance and what it covers when it comes to COVID-19. Now, you're going to want to check with your individual insurance provider to see how it applies to you, but these questions and answers, they'll give you a really good idea. So, our first question, is COVID-19 testing covered by health insurance? The answer, testing is covered by most insurance policies with no out-of-pocket costs like deductibles and copays. Okay, so our next question, does Medicaid cover COVID-19 testing? Yes, testing is covered with no out-of-pocket costs, but a deductible and copay are still required for any treatment costs. All right, and the next question, speaking of treatment, how do health insurance companies handle COVID-19 treatments? The answer, many insurance companies are waiving out-of-pocket costs like deductibles and copays for COVID-19 treatments. And while we're all practicing social distancing, are telehealth appointments covered by insurance? Well, virtual doctor's appointments are becoming more and more common, so telehealth appointments are, yes, they are in fact covered by most insurance companies, including for COVID-19 concerns. But again, for all of these questions, you're going to want to talk to your insurance provider to see exactly what they will cover for you. Okay, now let's talk about possible vaccines. A possible vaccine. President Trump has launched Operation Warp Speed, aimed at speeding up the development of a vaccine for COVID-19. So could this help speed up what's typically a very slow process? And when can we expect a vaccine to be ready? I asked Dr. Lippy Roy.
We're all eager for a vaccine against this virus, this virulent pathogen. But, and while it's always promising to have funding, increased funding towards any type of scientific process, clinical trials included, and hopefully that'll get more people on the project, more manpower, more researchers and scientists, more supplies. That's great on one hand, but the truth is there are certain parts of the vaccine discovery process that simply can't be rushed, like the clinical trials, testing them in actual human beings for both safety, which is phase 1, and then efficacy, which is phase 2, and then phase 3 is testing in a much larger population. So there are certain things that it just takes time in order to do it right. So we're talking at least 1 to 2 years, really.
And since fever is a coronavirus symptom, a lot of people are buying thermometers right now, but which one works best? That's next. But first, another quick Q&A. You asked, can COVID-19 be transmitted through food? The answer, the Oregon Health Authority says there is no evidence that human or animal food or food packaging is associated with the transmission of COVID-19.
Online, and there are lots of thermometers you can buy. So which is best and how can you get the most accurate results? To find out, we asked Nisa Ernst. She's the nurse manager in endoscopy and biocontainment at Johns Hopkins Hospital.
We have found is that the temporal thermometers actually work the best.
Temporal thermometers are a newer type that you place against your forehead to get a reading. It's that fast too.
Yeah, it's that fast. And then you're simply wiping it down with an alcohol wipe, and you can take the next employee that's coming in.
So they're quick, easily cleaned, and Ernst says they're by far the most accurate. But they are more expensive and not as easy to find. So what about infrared or digital thermometers? They're all over online and in stores. Is that better than nothing?
Absolutely, no question. And everybody should have a thermometer like this at home.
Ernst says most modern thermometers are pretty accurate, but the infrared and digital ones are more likely to be affected by outside factors like the temperature of the room or sunlight. Still, any thermometer works as long as you test at the right time.
Go out and get a basic thermometer and take your basic temperature before you're febrile.
The CDC says for most, a fever is temperatures above 100.4 degrees, but some people run hot or cold. So if you test before you have a fever, you can compare that number when you are feeling sick. Even if you're above or below the average, you'll know if the temperature is high for you. So now you've got a thermometer. Where should you test on your body? Ernst says rectal tests are the most accurate, but most people won't do that. Next would be an oral test, and she said ear thermometers are often off by a few degrees. So bottom line, Ernst highly recommended temporal thermometers, especially for businesses that are looking for a quick and sanitary way to test employees coming back to the office. But she also said any thermometer is better than none. The key is testing before you're feeling sick so you know if your temperature is higher than normal. Oh, and last thing, if you have a glass thermometer...
And a simple message is glass thermometer, get rid of it.
If you've got more questions, send us an email. With your Verify, I'm Jason Puckett.
All right, here's a question we're getting from a lot of people. Should you practice social distancing with your pets? The answer... Welcome back. You know, this has a lot of you talking, pets and social distancing. So should pet parents keep their animals away from people and other animals? Morgan Romero found out the answer.
During the COVID-19 pandemic, veterinarians and public health officials say you should avoid letting your pets interact with anybody, two-legged or four-legged, outside of your household. So even as states are loosening up regulations around the country, you should still practice social distancing, and so should your pets, keeping that at least 6-foot distance away from other people. I know it is so tempting to want to pet other people's puppies while you're out on a walk, or if you have an indoor-outdoor cat, they're cooped up all day and you want to let them outside. But the CDC says at this point in time, we need to be cautious. A few pets and animals have tested positive for COVID-19 here in the United States. That's after coming into close contact with somebody who was confirmed to have COVID-19. Now, the main way the virus is spread is from person to person, but without enough testing and evidence and data, we can't rule out the fact that animals can transmit the virus or humans can transmit the virus to animals. Again, though, your risk of exposure is really low with animals. Experts say you have a much better chance of catching the virus from people. But if you are sick, if you have been diagnosed with COVID-19, what you should do is avoid cuddling or snuggling with your pets, also very hard at this point in time, and wear a face covering anytime you're taking care of them.
All right, thank you, Morgan, and thank you for joining us tonight. KGW is committed to answering your coronavirus-related questions. If you still have questions, our past stories may answer them for you. You can go straight to kgw.com/answers to see all of our past Q&As, all of our past stories.